Hello, everyone. Welcome to our presentation, CareBridge, a solution for care for postpartum depression.
So why is this important? So let's look at our statistics. As you can see, there's some certain important statistics. You can see 60% of women who experience postpartum depression don't actually get diagnosed. They go undiagnosed. Additionally, 40% of them who have PPD symptoms don't even reach out to seek help. That's just a few of the important statistics. Next. So our mission was to improve patient care for women experiencing postpartum depression, a condition affecting nearly 20% of new mothers. So we wanted a solution that could directly address this mission, and we wanted to develop an app that tracks women's health through a chatbot, journaling, and wearable device biomarkers, providing alerts when professional evaluation be needed. However, we slowly realized that all of these different attributes might be too much to actually solving our mission. Next slide. So what we developed, our problem statement now is that mothers often screen in the moderate range of an EPDS scale, which is the initial screening that pediatricians give. Often being overlooked for postpartum mental health care, these patients may not meet the threshold for emergency psychiatric intervention, yet still experience a lot of distress. So the solution that we decided to go for is, since these women are often overlooked with a moderate EPDS scale, we decided to make a tool that automates the outreach to psychiatrists, helping providers quickly find those, accept insurance, and admit patients.
Yeah, so kind of going over a high-level overview of how this works. So the nurse or medical assistant would search for the patient who the physician has identified with a low or moderate EPDS score to begin the scheduling process. Then, based on the patient's location, insurance, we have a self-developed API that searches for psychiatrists in the area and prioritize rating because we want to ensure that the patient can get the best care that they can get. The next step would be the automated calling would commence. So using 11 labs for text-to-speech and Twilio for calling, we would autonomously call each provider on the curated list. And lastly, as the calls are commencing, their statuses will be updated in our dashboard in real time, allowing nurses and medical assistants to quickly view available providers and follow up for scheduling.
So now for our market competition. There was four main areas for the market competition that we saw that we had an area compared to the others. So for CareBridge, first of all, we have automation. So we saw that most other companies or things that are in the field don't actually automate the calls to the psychiatrists themselves, making it easier for the doctors. Secondly, referrals. A lot of these companies also don't use a referral method. They don't use an intermediary doctor to actually contact the psychiatrist. They just rely on the patients to do it themselves, which a lot of patients then feel discouraged to do. Additionally, we have moderate PPD. We target specifically patients with moderate postpartum depression so that these patients who aren't actually being addressed or targeted then have a chance to. Finally, we have location matching. A lot of these companies also don't match based off the location or nearby places. They only match based off whoever's available.
So lastly, we have our conclusions and areas for improvement slide. So we've kind of identified these as the following aspects for how we could enhance our application. So the first thing would be seamless EMR integration. So we obviously want to ensure that we are integrating with hospitals' EMR systems to streamline data exchange and reduce manual entry for clinicians. The second thing is you want to enhance accessibility for the app because currently in our 11 Labs configuration, we have English and Spanish set up, but we want to ensure that people of all languages could use our app for their patients as well, who may speak a different language. The third thing is we want to increase our scalable cloud infrastructure. So this would include the spin up of a CI/CD pipeline and deployment to Azure or AWS. Lastly, we want to include an email or text notification system for the nurse or medical assistant when a provider becomes available and when the insurance compatibility is a match. Thank you for listening.
Thank you.
I'm gonna do a live demo of our search tool. So basically, the nurse would have to put the patient information. So we create a fake patient in our database. So you put her information and you click search, and it pulls up all the doctors in her location that accept her insurance. And in this list, we try to match a doctor that can accept the patient as soon as possible. We're going to show you more with Jesse's demo of that process.
This is a demonstration of the calling functionality in which a doctor receives an automated message from our system where they will receive a message prompting them to enter a number indicating their availability in the next few days of whether they can schedule an appointment, as well as if they accept the patient's specific insurance. And I will demonstrate that now. So my phone is registered as a doctor, and I'm going to receive a call right here when I answer this.
You have a trial account.
And this is part of the API that we're using, so I could skip this to move to the real.
Hello, this is an automated scheduling assistant calling from Robert Wood Johnson, St. Barnabas Hospital in New Brunswick, New Jersey. We are trying to arrange an urgent appointment with a psychiatrist for a patient with a concerning EPDS score. Please press 1 if there is availability within the next 72 hours, or 0 if not.
See, they're asking for availability, so I'll put 1.
Please press 1 if you accept the patient's insurance provider, Aetna, or 0 if not. If you press 1, a nurse or medical assistant will contact you shortly.
Okay, so I'm going to put 1.
Thank you. If we do not follow up within 1 business day, it means that either our criteria were not met or another psychiatrist was available. We appreciate your time and hope you have a great day.
As you can see, appointment was scheduled, or sorry, a message was sent to speed up this process of getting an appointment scheduled, and the nurse will be in contact with this doctor now that they have indicated that they're available and can accommodate for the nurse and their needs.